The security detail trailing Prince William through the narrow streets of central London that December morning in 2005 had no idea they were witnessing the beginning of a revolution. At 23, the young prince had already completed his military training and was preparing for a lifetime of ribbon cuttings, charity galas, and carefully orchestrated public appearances. But something about that particular morning felt different. William had requested to visit the Passage, a homeless day center near Victoria Station, without the usual fanfare. No press. No formal reception. Just a quiet tour to understand what homelessness actually looked like beyond the statistics and briefing papers that crossed his desk. The center's director, Mick Clark, had been skeptical when the request came through royal channels. Another royal visit, he thought. Another photo opportunity that would change nothing for the people who came through their doors every day seeking warmth, food, and basic dignity. But, as William walked through the center that morning, something unexpected happened. Instead of the usual quick handshakes and polite small talk, he stopped. He sat down at a plastic table where a group of men were eating breakfast. He asked questions that had nothing to do with protocol and everything to do with genuine curiosity. How long had they been without homes? What had led them here? What did they need most? The men around that table had spent years being invisible to society. They were accustomed to people crossing the street to avoid them, to being moved along by police, to being treated as problems rather than people. Here was a prince, someone born into unimaginable privilege, asking about their lives as if their stories mattered. The conversation that followed would change everything. James, a former construction worker, told William about the injury that ended his career, and the cascade of events that followed. Lost job, lost income, lost home, lost hope. Sarah, one of the few women at the center, shared how domestic violence had forced her onto the streets with nothing but the clothes on her back. Marcus, barely 18, explained how aging out of the care system had left him with nowhere to go and no one to turn to. As William listened, he began to understand that homelessness wasn't about personal failure or choice. It was about a system that could fail anyone, anywhere, at any time. It was about mental health services that were overwhelmed, housing that was unaffordable, support networks that didn't exist, and a society that had learned to look away from its most vulnerable members. Mick Clark watched from across the room as the prince's bodyguards grew increasingly uncomfortable with how long the visit was taking. Royal schedules were precise things measured in minutes, not the hours this conversation was stretching toward. But William seemed oblivious to time, completely absorbed in the stories he was hearing. When the visit finally ended, William didn't simply shake hands and leave. He asked Mick if he could come back. Not for another official visit, but to volunteer. To spend time with the people who used the center. To learn more about the complexities of homelessness beyond what any briefing could tell him. Mick was stunned. In 30 years of running homeless services, he had never had such a request from anyone in authority, let alone a member of the royal family. But there was something in William's eyes, an intensity of purpose that made Mick believe this wasn't just royal curiosity. This was something deeper. Over the following months, William began returning to the Passage regularly. He helped serve meals, listen to stories, and gradually began to understand the intricate web of factors that created and sustained homelessness. He learned about the hidden homeless, people sleeping in cars or on friends' couches, technically housed but fundamentally unstable. He met families living in temporary accommodation for years, children trying to do homework in a single room shared with parents and siblings. Each visit deepened his understanding and strengthened his resolve. William began reading academic research on homelessness, studying policy papers, and meeting with experts across the field. He discovered that homelessness wasn't an unsolvable problem. Countries like Finland had virtually eliminated rough sleeping through comprehensive approaches that combined housing, mental health support, and social services. The solutions existed. What was missing was the political will and public support to implement them. The turning point came during a particularly cold winter night in February 2006. William had been volunteering at the Passage for several months when Mick approached him with an unusual request. Would he be willing to sleep rough for a night, to experience firsthand what it meant to have nowhere to go when the temperature dropped below freezing? The security implications were enormous. The potential for public relations disaster was significant. But William didn't hesitate. He wanted to really understand what the people he had been meeting faced every night. On a bitter February evening, William found himself in a narrow alley behind a shopping center, wrapped in a thin sleeping bag, with only cardboard between his body and the concrete. The cold was immediate and penetrating, seeping through every layer of clothing, making sleep impossible. But it wasn't just the physical discomfort that affected him. It was the vulnerability, the constant awareness of being exposed and defenseless, the psychological impact of being reduced to finding shelter wherever possible. As he lay there through the long hours of that night, listening to the sounds of the city around him, William experienced something that would fundamentally shape his understanding of homelessness. It wasn't just about lacking shelter. It was about losing dignity, security, and hope. It was about becoming invisible to a society that preferred not to see its failures. When dawn finally came, William was exhausted, cold, and profoundly moved. But more than that, he was angry. Angry that in one of the world's wealthiest nations, people face this reality not for one night as an experiment, but for months and years as a daily struggle for survival. The security team who had discreetly monitored his night on the streets reported that the prince had barely moved for hours, seemingly lost in thought. What they couldn't know was that those hours had crystallized something in William's mind. This wasn't going to be a temporary charitable interest or a phase in his royal development. This was going to be the focus of his life's work. In the weeks following his night sleeping rough, William began developing what would become a comprehensive strategy for addressing homelessness. He reached out to policy experts, housing advocates, mental health professionals, and most importantly, to people who had experienced homelessness themselves. He began to understand that meaningful change would require not just charity but systemic transformation. His first major decision was to use his platform to change the national conversation about homelessness. Instead of viewing it as an individual failing, he would help people understand it as a societal challenge that demanded collective action. Instead of perpetuating stigma, he would humanize the issue by sharing the stories of people he had met. But William also understood that his royal position came with both advantages and limitations. He could raise awareness and generate resources, but he couldn't directly change government policy. He could support existing organizations, but he needed to be careful not to overshadow the expertise of people who had been working in the field for decades. The strategy he developed was sophisticated and long-term. He would work behind the scenes to build coalitions between government, business, and charitable organizations. He would use his public platform to keep homelessness in the national conversation. Most importantly, he would maintain direct contact with people experiencing homelessness, ensuring that their voices remained at the center of any solutions. As 2006 drew to a close, William made a private commitment that would define the next 20 years of his life. He would not allow himself to become another well-meaning royal who expressed concern about social issues without making a meaningful impact. He would dedicate whatever time and resources necessary to ending homelessness in Britain, no matter how long it took. The young man who had walked into the passage that December morning as a dutiful prince was gone. In his place was someone with a mission, someone who had been fundamentally changed by encountering the reality of homelessness. The question now was whether he could translate that personal transformation into the kind of sustained, systematic change that could actually solve the problem. Mick Clark, watching William's evolution over those crucial months, began to believe that maybe, just maybe, this time would be different. Maybe this time the attention and resources would lead to real change rather than just temporary sympathy. But he had been disappointed before by promises from politicians and public figures. Time would tell whether Prince William's commitment was genuine, and whether it would endure when other priorities and responsibilities demanded his attention. What Mick couldn't have predicted was that William's commitment would not only endure but deepen with each passing year, growing into one of the most sustained and comprehensive royal campaigns in modern British history. The seeds planted during those early visits to the passage were about to grow into something extraordinary. By 2008, Prince William's commitment to addressing homelessness had evolved from personal passion to strategic action. The young prince who had once spent a night sleeping rough had become a student of housing policy, urban planning, and social services. His private office at Clarence House had transformed into an informal headquarters for what would become one of the most comprehensive approaches to homelessness ever undertaken by a member of the royal family. The walls of his study were covered with maps showing rough sleeping patterns across London, charts tracking housing costs and availability, and photographs of people he had met during his regular visits to homeless services. Each face represented a story, a life disrupted by circumstances often beyond individual control. These weren't statistics to William anymore. They were friends, acquaintances, people whose struggles had become personal to him. His approach during these early years was methodical and deliberate. William understood that sustainable change required more than royal attention and charitable donations. It needed systematic thinking, evidence-based solutions, and the kind of long-term commitment that could outlast political cycles and media attention spans. He began building relationships with everyone from street outreach workers to government housing ministers, from formerly homeless individuals to academic researchers studying the economics of housing. The learning process was intensive and sometimes painful. William discovered that homelessness was far more complex than he had initially understood. There was no single cause and therefore no simple solution. Mental health issues, substance abuse, domestic violence, economic displacement, family breakdown, military service trauma, and aging out of care systems all contributed to different pathways into homelessness. Each required different interventions and support systems. More challenging was learning about the ways well-intentioned efforts sometimes made problems worse. Traditional emergency shelters, while providing immediate relief, could trap people in cycles of instability. Some charity approaches, focused on managing rather than solving homelessness, inadvertently created dependency rather than pathways to independence. Housing programs that didn't address underlying mental health or addiction issues often failed to create lasting stability. William's education came not just from experts and research papers but from spending time with people experiencing homelessness in various circumstances. He met rough sleepers who had been living on the streets for decades, families crowded into single rooms in temporary accommodation, young people sofa surfing with friends or acquaintances, and individuals living in cars or makeshift shelters in parks and under bridges. Each encounter deepened his understanding of the human cost of housing instability. He met children whose education suffered because they moved from temporary accommodation to temporary accommodation, never staying long enough to settle into schools. He learned about the health impacts of stress and uncertainty, the way homelessness accelerated aging, and exacerbated existing medical conditions. He discovered how difficult it was to maintain employment without a stable address, how impossible it was to escape homelessness without income, and how the cycle perpetuated itself. But William also discovered remarkable resilience and dignity among people facing these challenges. He met individuals who shared their limited resources with others who had even less. He encountered people who maintained hope and humor despite circumstances that would break many others. These experiences taught him that homelessness didn't define people's worth or potential. Given the right support and opportunities, people could rebuild their lives in extraordinary ways. The first major initiative William developed during this period was what he called invisible partnerships. Rather than creating new organizations or programs that would bear his name, he worked behind the scenes to strengthen and connect existing services. He used his influence to facilitate meetings between government officials and frontline workers, to connect housing developers with social service providers, and to bring together businesses that could provide employment opportunities with programs that supported people transitioning out of homelessness. These partnerships were deliberately kept out of the public eye. William had learned that media attention, while sometimes helpful for raising awareness, could also disrupt delicate negotiations and make it harder for people to work together without worrying about political implications. By operating quietly, he could often achieve more concrete results than through high-profile public campaigns. One of his most successful early interventions involved connecting a private housing developer with a mental health charity to create supported accommodation specifically designed for people with severe mental health issues who had been cycling through emergency services. The project required complex negotiations between local government, healthcare providers, and private investors. William's role was primarily as a facilitator, using his access and credibility to keep conversations moving when they threatened to stall. The result was a 40-unit development that provided not just housing, but on-site mental health support, life skills training, and pathways to independent living. More importantly, it served as a model that could be replicated in other areas. William had learned that solving homelessness required changing systems, not just helping individuals. and this project demonstrated that innovative partnerships could create new possibilities. Another early focus was on prevention, recognizing that it was far more effective and cost-efficient to prevent homelessness than to respond to it after it occurred. William worked with organizations supporting young people aging out of care, military veterans transitioning to civilian life, and families facing eviction due to economic hardship. These prevention efforts rarely generated headlines, but they kept hundreds of people from experiencing homelessness in the first place. The military veteran work was particularly personal for William, given his own service background. He discovered that many veterans struggled with the transition from military to civilian life, particularly around housing and employment. The structured environment and clear purpose of military service sometimes left veterans feeling lost and disconnected in civilian life. Some turned to substances to cope with trauma or depression. Others simply struggled with practical aspects like finding affordable housing or translating military skills into civilian employment. William began working with veteran organizations to develop transition programs that addressed housing, employment, and mental health support as interconnected challenges, rather than separate issues. He helped secure funding for programs that provided temporary supported housing for veterans while they developed civilian careers and permanent housing plans. He also advocated for better recognition of military experience in civilian employment, helping connect veterans with employers who valued their skills and training. By 2010, Williams' approach had matured into what housing experts began calling systems thinking. Instead of focusing on individual interventions, he was working to change the entire ecosystem around homelessness. This meant addressing housing supply and affordability, mental health and addiction services, employment training and support, and social safety nets that could prevent crises from escalating into homelessness. The scale of this ambition was enormous, and William understood that meaningful progress would take decades rather than years. But he had also begun to see evidence that change was possible. The partnerships he had facilitated were producing measurable results. People were being housed. Services were becoming more effective. Political and public attitudes were beginning to shift. More importantly, William had developed the expertise and credibility to speak authoritatively about homelessness policy. Government officials took his calls. Service providers sought his input on program design. Researchers shared their findings with him before publication. He had become not just a royal patron of homeless services, but a genuine thought leader in the field. This credibility would prove crucial as William began to develop more ambitious plans for addressing homelessness at scale. He had spent 5 years learning the complexities of the issue and building relationships across all sectors involved in addressing it. He had tested approaches and learned from both successes and failures. Most importantly, he had maintained direct contact with people experiencing homelessness, ensuring that his understanding remained grounded in lived experience rather than abstract policy discussions. The foundation he built during these years would support everything that followed. By 2010, William was ready to move from behind-the-scenes facilitation to more public leadership on homelessness issues. He had learned how to navigate the complex relationships between government, business, and charitable organizations. He understood the evidence base for effective interventions. He had built trust with people across the homelessness sector. Most importantly, he had developed a sophisticated understanding of how to use his royal platform for maximum impact. He knew when public attention would be helpful and when it would be counterproductive. He understood how to balance his role as a future king with his passion for social change. He had learned to be patient with slow progress while maintaining urgency about the human cost of inaction. The quiet, strategic work of these foundational years would soon bear fruit in ways that surprised even William himself. The networks he had built, the expertise he had developed, and the credibility he had earned would enable him to launch initiatives that would fundamentally change how Britain approached homelessness. But, perhaps most importantly, he had learned that solving complex social problems required the kind of sustained, systematic commitment that could outlast political changes and economic fluctuations. As 2010 began, William was preparing to step into a more public role in addressing homelessness, armed with 5 years of intensive learning and relationship building. The foundation was solid. The question now was whether he could build something transformational upon it. The morning of June 15, 2011, marked a turning point in Prince William's fight against homelessness. Standing before a gathering of over 200 people in the ballroom of a London hotel, representing everyone from government ministers to formerly homeless individuals, William was about to make his first major public statement on homelessness. The 5 years of quiet learning and behind-the-scenes work were about to give way to a very public campaign. The audience that morning was unlike any that had gathered around a royal event before. Rough sleepers sat next to cabinet ministers. Social workers shared tables with business leaders. Housing researchers chatted with frontline charity workers. William had insisted on this mix, understanding that solving homelessness required bringing together people who rarely shared the same spaces, let alone work toward common goals. His speech that morning was carefully crafted but deeply personal. He spoke about his journey from that first visit to the passage to his current understanding of homelessness as one of the most complex and urgent challenges facing modern Britain. He talked about the people he had met, their struggles and their resilience. But, most importantly, he outlined a vision for ending homelessness that was both ambitious and practical. "Homelessness is not inevitable," William declared, his voice carrying across the silent room. "It is a policy choice. Other countries have virtually eliminated rough sleeping. We can do the same. But only if we work together, only if we commit to evidence-based solutions, and only if we remember that behind every statistic is a human being deserving of dignity and opportunity." The speech announced the launch of what would become William's signature initiative, the Homelessness Partnership, a coalition bringing together government, business, charities, and people with lived experience of homelessness to develop and implement comprehensive solutions. Unlike traditional royal patronages that primarily raised awareness and funds, this partnership aimed to create systematic change. The media response to William's public emergence as a homelessness advocate was immediate and largely positive. Here was a prince who had done his homework, who spoke with authority about housing policy and social services, who could discuss the complexities of mental health provision and addiction treatment with genuine understanding. Editorial writers praised his serious approach to what they called real royal leadership on social issues. But William had learned enough about homelessness to know that media attention, while valuable for raising awareness, could also create unrealistic expectations for quick fixes. Homelessness had been developing as a crisis over decades. Solving it would require sustained effort measured in years, not months. The challenge was maintaining public and political attention long enough for meaningful change to occur. His strategy for sustaining attention was innovative. Rather than relying on traditional royal visits and speeches, William began what he called solution showcasing. Every few months, he would highlight a successful intervention or innovative program, demonstrating that homelessness could be addressed effectively when the right approaches were used. These showcases served multiple purposes. They maintained media attention, provided concrete examples of what worked, and encouraged replication of successful models. One of the first programs William showcased was a Housing First initiative in Manchester that had housed over 400 people who had been sleeping rough for extended periods. The program challenged conventional wisdom by providing people with permanent housing immediately, then wrapping support services around them rather than requiring them to prove their readiness for housing through periods in temporary accommodation or treatment programs. The results were remarkable. Over 85% of people housed through the program remained stably housed after 2 years. Emergency service use dropped dramatically. Health outcomes improved significantly. Most surprisingly to critics, housing people immediately proved to be more cost-effective than the previous system of cycling people through shelters, emergency services, and temporary programs. William's showcase of the Manchester program included spending a day with participants, meeting with staff, and then bringing government officials and media to see the program in action. His role was not to take credit for the program's success, but to ensure that successful models received the attention and support needed for expansion to other areas. This pattern of showcasing successful interventions became a hallmark of William's approach. He highlighted supported employment programs that helped people with mental health challenges find and maintain work. He showcased innovative housing developments that combined affordable units with on-site support services. He brought attention to prevention programs that helped families avoid eviction and homelessness. Each showcase was accompanied by detailed policy briefings that William's team developed in collaboration with researchers and practitioners. These briefings explain not just what worked but why it worked and how it could be replicated elsewhere. William was using his platform not just to raise awareness, but to facilitate the spread of evidence-based solutions. The impact of this approach became evident in 2013 when the government announced significant changes to homelessness policy, adopting many of the approaches that William had been showcasing. Housing First became official government policy. Funding was allocated for prevention services. Mental health support was integrated into housing programs. While these changes resulted from multiple factors, housing advocates credited William's systematic showcasing of successful models with creating the political momentum needed for policy reform. But William's most significant contribution during this period was changing the public conversation about homelessness itself. Through his speeches, interviews, and program visits, he consistently challenged stereotypes and misconceptions that perpetuated stigma around homelessness. He spoke about the complex pathways that led to housing loss, the structural factors that made escape difficult, and the remarkable resilience of people facing these challenges. His approach was always to lead with stories rather than statistics. He talked about Sarah, the former teacher who lost her home after a cancer diagnosis led to job loss and mounting medical bills. He shared the story of Mark, the military veteran whose undiagnosed PTSD contributed to relationship breakdown and eventual rough sleeping. He spoke about Maria, the single mother who became homeless when her landlord suddenly doubled her rent and no affordable alternatives were available. These stories, told with permission and dignity, help the public understand that homelessness could affect anyone facing a combination of personal crisis and structural barriers. This understanding was crucial for building the political and social support needed for comprehensive solutions. William also used his platform to highlight the expertise and leadership of people who had experienced homelessness themselves. He insisted that formerly homeless individuals be included in policy discussions, program design, and public events. This wasn't just symbolic inclusion, but recognition that people with lived experience brought essential insights that couldn't be gained any other way. One of the most powerful moments in William's public campaign came during a parliamentary hearing in 2014, where he testified about homelessness policy alongside 3 individuals who had experienced various forms of housing instability. The sight of a prince sharing a witness table with people who had been homeless, treating their expertise as equal to his own, sent a powerful message about whose voices mattered in addressing social problems. The parliamentary testimony also demonstrated how much William's understanding had deepened over nearly a decade of engagement with homelessness issues. He fielded technical questions about housing supply, mental health service integration, and employment support programs with expertise that impressed even skeptical MPs. This wasn't a royal giving well-meaning but shallow commentary on social issues. This was someone who had genuinely mastered the complexities of homelessness policy. By 2015, the Homelessness Partnership had grown into a coalition of over 50 organizations spanning government departments, major businesses, housing associations, mental health charities, and advocacy groups led by formerly homeless individuals. The partnership had influenced policy changes that provided more stable funding for homelessness services, reformed housing allocation procedures to prioritize prevention, and integrated mental health and substance abuse treatment with housing support. More measurably, rough sleeping in areas where partnership-supported programs operated had decreased by over 40%. Emergency service used by formerly homeless individuals had dropped significantly, saving millions in healthcare costs. Employment among people supported through partnership programs had increased to levels comparable to the general population. The systematic approach that William had developed was producing systematic results. But perhaps the most significant achievement of this period was the cultural shift in how homelessness was understood and discussed in Britain. Public opinion surveys showed dramatic changes in attitudes toward homeless individuals and support for comprehensive solutions. Political parties across the spectrum had incorporated homelessness policy into their platforms. Business leaders increasingly saw addressing homelessness as both a social responsibility and an economic opportunity. The media, which had once covered homelessness primarily through stories about individual hardship or charity appeals, began reporting on policy innovations, successful programs, and systematic approaches to addressing housing instability. This shift in media coverage both reflected and reinforced the broader change in public understanding that William had helped create. As 2015 drew to a close, William's public campaign had achieved something remarkable. Homelessness had become a priority issue for government and society in ways it had never been before. Evidence-based solutions were being implemented at scale. Public attitudes had shifted toward greater understanding and support for comprehensive approaches. The foundation for ending homelessness in Britain had been laid. But William understood that public attention could be fickle and that political priorities could shift with changing governments and economic conditions. The challenge ahead was ensuring that the progress achieved could be sustained and built upon regardless of changes in political leadership or economic circumstances. This would require embedding the approaches he had championed so deeply into policy and practice that they would survive any future challenges. The public campaign had been successful beyond William's initial hopes. The question now was whether he could use this success to create lasting institutional change that would outlast his own involvement and finally solve the problem that had consumed his attention for over a decade. The success of Prince William's public campaign against homelessness had created an unexpected challenge by 2016. The awareness was there. The political support existed. Funding had increased significantly. But William had learned that scaling successful pilot programs to address homelessness across an entire nation was exponentially more complex than running even the most sophisticated individual initiatives. The question that kept him awake at night was no longer whether solutions existed, but whether they could be implemented at the scale necessary to truly end homelessness. The complexity of scaling became evident when William attempted to expand the Housing First model that had been so successful in Manchester to other cities across Britain. What worked perfectly with 400 people in one city with established services and strong local leadership faced entirely different challenges when applied to thousands of people across dozens of cities with varying levels of infrastructure, political support, and existing services. In Birmingham, the local housing market made it impossible to find affordable units for the program. In Newcastle, mental health services were already overwhelmed and couldn't absorb the additional demand. In London, the sheer scale of rough sleeping meant that even successful programs felt like drops in an ocean of need. Each location required different adaptations, different partnerships, and different solutions to implementation challenges. William spent months in 2016 traveling between cities, meeting with local officials, service providers, and people experiencing homelessness to understand these variations. He discovered that homelessness looked different in every community. Rural homelessness often involved people sleeping in cars or makeshift shelters in isolated areas, largely invisible to services designed for urban rough sleeping. Coastal towns dealt with people who had migrated seeking warmer weather or simply reached the end of the country with nowhere else to go. Industrial cities faced homelessness connected to economic displacement as traditional industries declined. These variations required different solutions. Rural areas needed mobile services that could reach people in isolated locations. Coastal towns needed coordination between multiple jurisdictions as people moved between areas. Industrial cities needed programs that combined housing with employment training for new economic realities. The one-size-fits-all approach that had seemed logical when scaling successful models simply didn't work in practice. This realization led William to develop what he called adaptive scaling, an approach that identified core principles from successful programs while allowing for significant local variation in implementation. The core principles were evidence-based: immediate access to stable housing, wraparound support services, consumer choice and control, and pathways to independence. But how these principles were implemented would vary dramatically based on local context, resources, and needs. Adaptive scaling required a much more sophisticated approach to supporting local implementation. Instead of simply providing funding and hoping for replication, William's team began offering intensive technical assistance to help communities adapt successful models to their specific circumstances. This meant deploying experts in housing development, mental health service design, employment programs, and data systems to work directly with local teams. The technical assistance approach revealed another layer of complexity. Many communities lacked the infrastructure needed to implement comprehensive approaches to homelessness, regardless of how much funding or expertise was available. Some areas had housing but no mental health services. Others had excellent healthcare but no affordable housing. Still others had strong charitable organizations but weak government support. Building this infrastructure became a major focus of William's work from 2017 onward. He began facilitating partnerships between communities with complementary strengths and needs. Cities with expertise in housing development shared knowledge with areas struggling to create affordable units. Regions with innovative mental health programs provided training and support to areas trying to integrate health and housing services. One of William's most ambitious infrastructure projects was the creation of a national homelessness data system, a coordinated approach to tracking and analyzing homelessness across the entire country. Before this system, each local area collected different information using different methods, making it impossible to understand the true scale of homelessness or track progress in addressing it. The data system faced enormous technical and political challenges. Local organizations worried about privacy, additional administrative burden, and potential misuse of information. Government agencies had different reporting requirements and data standards. Service providers used incompatible computer systems and had varying levels of technical capacity. William's role in overcoming these obstacles was primarily diplomatic. He spent months in meetings with local officials, service providers, and advocacy groups, listening to concerns and working to address them. He brought in technical experts who could solve compatibility issues between different computer systems. Most importantly, he demonstrated how better data could improve services for people experiencing homelessness, rather than simply creating additional bureaucratic requirements. The result was a data system that, by 2018, was tracking over 300,000 individuals experiencing various forms of housing instability across Britain. For the first time, policymakers could see patterns across the entire country. They could identify which interventions were most effective in different contexts. They could spot emerging trends and allocate resources based on evidence rather than assumptions. The data revealed surprising patterns that changed how William and others understood homelessness. Rough sleeping, which received the most public attention, represented only about 15% of total homelessness. The majority of housing instability involved families with children living in overcrowded or temporary situations. Young people represented a disproportionate share of the hidden homeless, often staying with friends or acquaintances rather than seeking formal services. These patterns led William to expand his focus beyond rough sleeping to address the broader spectrum of housing instability. He began championing family homelessness prevention programs that helped families facing eviction access emergency assistance, legal support, and alternative housing options before they lost their homes. He supported youth programs that provided both housing and life skills training for young people aging out of care or family conflict. The expansion of focus required new partnerships and approaches. Working with families involved different expertise than working with single adults experiencing chronic homelessness. Child welfare considerations added legal and practical complexities. Schools became important partners in identifying families at risk of homelessness. Healthcare providers needed to understand how housing instability affected child development and family health. William's approach to these new challenges followed the same methodical pattern he had developed over the previous decade. He spent time with families experiencing homelessness, listening to their stories and understanding their needs. He met with service providers working in family programs. He studied research on the impacts of housing instability on children and families. He visited successful programs in other countries to understand different approaches. One of the most powerful experiences during this period was spending time with a family living in a single room in temporary accommodation. The family included 2 parents and 3 children, ages 5 to 15. They had been living in the room for 8 months after losing their previous home when the father's hours were reduced at his job. Despite both parents working, they couldn't afford market-rate housing in their area and were waiting for a social housing unit to. On a cold December morning in London, a future king of England sat on the frozen pavement outside a homeless shelter, sharing breakfast with a man who had been sleeping rough for 3 years. This wasn't a photo opportunity or a carefully staged royal visit. This was Prince William, 23 years old, quietly beginning a journey that would span 2 decades and challenge everything the British public thought they knew about homelessness. The man beside him, David, had once been a teacher. He had lost his job, then his home, then his hope. As steam rose from their shared cup of tea in the bitter morning air, David looked at the young prince and said something that would echo in William's mind for the next 20 years. Your Highness, most people walk past us like we're invisible. But you're sitting here and you're seeing us. That's more powerful than any charity donation. What David didn't know was that this moment would spark one of the most sustained and personal royal campaigns in modern history. Over the next 2 decades, Prince William would sleep on the streets, challenge government policies, fund revolutionary housing projects, and transform how an entire nation thinks about homelessness. This is not just the story of a prince fulfilling his royal duties. This is the story of a man who discovered his life's purpose in the most unexpected place, and refused to let the world look away from those society had forgotten. 20 years later, as William stands before cameras issuing his most powerful statement yet about ending homelessness, his journey reveals something profound about the power of sustained commitment, the complexity of social change, and what it truly means to serve others. This is that story.